All right, thanks a lot, Jim. Officer Rick Robles is our guest. He is a liaison officer with Fort Wayne Police Department. Officer Robles, what are some of the special problems with getting this information out to the immigrant community or to some of the minority communities in the town?
Our goal, Eric, is to get the best information and effectively communicate that in real time to populations that are at risk, especially with H1N1. Using media is probably the most important, but community forums also are the conduit for getting that information out.
Recent immigrant community, though, there's a serious language barrier there. Does that get in the way?
There's many languages spoken in our community, and the challenge is, those other languages. We do a pretty good job with like Spanish-speaking population. Burmese is emerging, and we're doing a good job there as well. I
know that we have there's several viewing parties going on around town watching this program. Viewing parties attended by immigrant and minority populations. Our own Brian McElhatton is at St. Patrick's Church with a Hispanic viewing party. Brian, how is that out there?
Hey, I'm here at St. Patrick's Parish. That's on South Harrison Street. You can look over my shoulder. You can see the program on the monitor right now. There is an interpreter there who is translating the English into Spanish, and when you consider Fort Wayne's sizable Latino community, you can understand the very importance of this particular event. Joining me is one of the organizers of it, Laura Delira Lopez. Laura, thanks for being here. Tell me about the tremendous need for something like this.
Yes. I think we really needed some information, first-hand information in Spanish. So that's why it was really, really important for us to have this site. And as you can see, we have a good translator. And I was thinking, well, it's very important because if a case of this virus comes up in our family or in any person who we know, time management and to approach the proper sites is going to be crucial in this kind of.
Do you feel there's enough information for the non-English speakers in the community?
Well, I think it's basic information. We have to encourage our people to ask questions and to look for some more information because, as you know, not everybody has the opportunity to access the internet. So I think the basics we can get them.
Okay, Laura Delira Lopez, thank you very much for being here. And again, this is one of 9 alternative viewing locations for those who don't speak English or maybe who only use it sometimes use it as a second language. A very important resource for those in the community to learn more about H1N1. Eric, back to you.
All right, Brian, thanks a lot for that report. Betty Brown is with Parkview, and she is here to discuss a number of things. One thing I'd like to ask is how are we tracking the spread of this virus within the community? I know you folks are on top of that. What sorts of methodology do you use?
Yes, at Parkview we have a Monday morning call, a 15-minute call, and we check in with all of our healthcare facilities and our physician practices to ensure we know what are we seeing here in Northeast Indiana.
You actually keep a count?
We keep a count.
Yes. And what are you seeing as of today?
Well, it's not heavy influenza-like illness. We know that it's widespread now in Indiana, but what we're seeing is that we do have some influenza-like illness, people coming in with respiratory problems, but to date, we haven't had to restrict visitors because we don't think it's heavy enough to do that.
How does someone decide? I talked this earlier with Dr. Mann. How does someone decide when to go to the doctor? That's a tough decision. I mean, they should make use of healthcare facilities when they feel they need them, shouldn't they?
Yes, they should. And of course, this illness has usually fever, a cough, sore throat, body aches. And I think if they get to the point where they're very worried, maybe they can't breathe as well, those type of issues would definitely take them to a healthcare facility. And they might want to call their physician.
How will they be greeted once they reach the healthcare facility? Will it just be business as usual?
We will ask right away when they reach the healthcare facilities, whether a physician office or a hospital, what type of symptoms they're having. And if they have anything that mirrors influenza, we will probably give them a surgical mask. And we may even, depending on who else is in the facility, we may put them in a separate area. So that's what we're doing today.
What sorts of advice, what kind of advice would you give to people about preparing their bodies for this battle with the flu virus that's going to come, whether it's H1N1 or a more mild strain of flu? What can they do to handle it better?
Of course, we all know to improve your immune system, it's good to have less stress, have plenty of sleep, drink fluids, eat well, you know, take care of yourself. Those things all keep us from being as susceptible to infection as well as to influenza.
What do you think? What do you think is one or two of the worst things we do to our bodies that really affect our immune system?
I think that lack of sleep. We don't really. There's not a good way to measure that.
And that's bad with teenagers, and they're one of the high-risk groups for this
It is.
virus.
Of course, a lot of times they get plenty of sleep. It's just that they don't sleep at night. They just want to sleep in the day.
In school, I didn't say.
Oh no!
I didn't say that. Are you noticing any uptick in flu virus through your tracking process now, or is it holding steady, or is it declining?
It appears to be holding steady. We are seeing some influenza-like illness in all facilities, but it doesn't seem to be at great numbers. So that's why we haven't done any restriction of visitors. Some areas of the country have done that, and we believe that we may get to that point, especially since seasonal influenza is also now going to be a topic. So as we see that, we may be restricting visitors in our healthcare facilities.
With the swine flu before, several years ago, and the avian flu before that, there was talk of pandemic possibilities. Didn't come about, luckily, in 15 seconds. Is there a danger of us becoming inured to this sort of information?
Probably, but I think there's been a lot of information on H1N1 and how it is affecting our country. So I think there are very many people that are interested in what we're doing to treat.
And paying attention.
And they're paying attention.
Betty Brown, thank you very much for talking with us.
Thank you.
Let's go back to Bruce at the phone bank. Bruce?